There were so many times when we laughed because, first of all, a lot of people in this class have great senses of humor. But also, we can tell stories to one another that are familiar, you know, and sharing those, just sometimes you just gotta laugh. What's a doctor doing dealing with policy? Boy, that's a great question, because I don't like policy. I don't like all the stuff about where the funding comes from, and I don't like dealing with the politics. If I liked that stuff, I would be doing something else, you know. I'm in the trenches. I'm a medical director, but I spend most of my time working with kids and working with families. And what happens way up here with policy is largely what determines way down here when it's kid by kid by kid and family by family by family. And so, you know, earlier in my career, I really admired some psychiatrists who had taken it upon themselves to get involved in policy. And so I joined them. I learned a little about California state politics. And after a couple of years, I said to one of them, boy, I know this is important, but I'm just not really drawn to this stuff. And he said, you know, none of us are. We do it because it's important, and that's really how I feel. I don't really feel like I fit, but you do what you got to do.